Well, I think in my mind, malnutrition is important in two aspects. One is the unfortunate nature that particularly GI cancers like pancreatic cancer and some of these, they cause this cancer cachexia, which is really alterations in food intake and appetite, but also a kind of a pro-inflammatory response related to the cancer, which leads to often weight loss, muscle loss, and these changes in overall metabolism. So I think, and part of it does correlate with the aggressiveness of disease. So when we see patients with a lot of symptoms or concerns around weight loss and cachexia, particularly around these more aggressive inflammatory cancers like pancreatic cancer, we know that, that usually doesn't go well, meaning these patients are higher risk for bad outcomes. But I would say that's one aspect of it. I think the other aspect of it is, as both as a provider and a patient, we always want to focus on, well, what can I do? What can I do to improve my outcomes? Sure, I've got this cancer, but they want to do something to kind of help. And I would say we get more questions about nutrition than perhaps almost any question when we're, sitting and discussing with patients. And I think nutrition is one of those areas that patients are starved for information, and it's also just a domain or a facet of health that really they can control to some degree, outside of the cancer itself aspects. So I think that's, my interest in it. It's great to assess things that you can't change, but there are some things you can. And I would say nutrition is definitely a top aspect for intervention